Good afternoon, ladies and gentlemen, and welcome to the DeKalb Public Health Centennial Celebration. What a wonderful way to start the program with the smooth jazz sounds of the DeKalb School of the Arts Jazz Ensemble. They are under the direction of Mr. Moore. Mr. Moore, please stand up and wave. These young people play like professionals. You all are exceptionally good. So we're going to give you another round of applause. And we're looking forward to hearing from them again a little bit later. My name is Monica Pearson, and I am honored to be your MC this afternoon for this century of service. You know, that's what this event is all about, a century of service to the people of DeKalb County. To start our remarks, please welcome the board chair of the DeKalb Public Health, Dr. Sonia Alvarez Robinson.
Good afternoon, everyone. It's wonderful to see all of you. This is an exciting event. We've been looking forward to this for a long time. As Ms. Pearson said, I'm Sonia Alvarez Robinson, and I've had the honor of serving as the chair of the DeKalb Board of Public Health. We're getting used to the new name, aren't we? Outside of my role as board chair, I serve as the Associate Vice President of Strategy and Organizational Effectiveness at Georgia Tech. Any Georgia Tech Yellow Jackets in the room? But have had the opportunity to partner with public health since 2005 when I first moved to Atlanta. And it's been amazing to watch the work, the services that are provided. I'm so thankful to see all of you here today to join us for this wonderful occasion. I'm also extremely thrilled about the opportunity for us to really sort of express ourselves in this new name of public health. And the reason that it makes me so excited is because it really allows us to hone in on the two words that matter the most, public and health. And when you think of the word public, to me, public is about people. And it's people that are what this organization is all about. It's the diversity of the community, the services that are provided to protect and improve the health of the people. But it's also through the people. When I think about all the hard work that goes into the work that you, the staff, and the clinicians do every single day in public health, it's just tremendous. Sacrificing themselves, working long, hard hours, doing work that is very challenging, emotionally, physically, spiritually, but you do it. And you do it with love and dedication and commitment to the people who are the beneficiaries of those services. And we also know that's essential to the success of any public health organization is leadership. And I'm so grateful and honored to have the opportunity to work in partnership with our current DeKalb Public Health Director, Dr. Sandra Valenciano. And prior to that, had the honor of serving under Dr. Sandra Elizabeth Ford, who demonstrated determination and compassion, discipline, and fearlessness, just like our current leadership does. And that's what public health leadership is all about. And so as we think about the second part of that name, health, represents the proactive, strengths-focused approach to foster and cultivate health and well-being. It doesn't say, it's not about focusing on disease and illness. It's about focusing on what can we do to protect and promote and improve the health of the people in our county. So whether it's protecting people from threats of the environment, which is so important, or educating people to take the best care of themselves, public health is working upstream to prevent human suffering. As we reflect and celebrate, I challenge you to focus on the numerous health milestones of DeKalb County, where this amazing organization has delivered services that put people first through the dedicated professionals. I wholeheartedly believe that what you'll discover as you hear in this program, and if you haven't had an opportunity to look at the displays that are downstairs, it is a really exciting history. And so today, the mission lives on, the legacy continues, the dedication, perseverance of the people who are working on behalf of this county, innovative programs and services that are continuously working to get better every single day. On behalf of the board, I want to welcome you. Thank you for being here today. And I'm sure that you will enjoy the show as much as I. Thank you so much. Welcome again.
Thank you very much, Dr. Alvarez Robinson. Well, during the COVID pandemic, if you lived in the state of Georgia, you knew Dr. Kathleen Toomey because she became the face and the voice of the fight against COVID. As commissioner of the Georgia Department of Public Health, she was a voice of calm in the storm. Please welcome Dr. Toomey to the podium to bring greetings from Governor Brian P. Kemp and the executive branch of the state of Georgia, and of course, the Georgia Department of Public Health. Dr. Toomey.
It's such a thrill for me to be here today. I don't often do this, and let alone have to look at my picture, which you can tell was taken before COVID, because I don't look like that anymore. Oh well. And I do want to say COVID was a team effort and all of us working together. It's not just one person at the top of any organization, and for that I thank you. But it also is so much fun seeing public health partners, public health staff, many people with whom I have interacted on the phone or on Zoom calls or over many years. I don't see CEO Thurman. Is he here? Not yet? Well, he'll miss my joke then, because he and I have worked together for more years than I'm sure he wants to remember, almost as long as I've worked with who was then Senator Mary Margaret, now Representative Mary Margaret, and she helped us pass the first chlamydia bill. Woohoo! Some people thought it was the state flower, but we set them straight. But I also, in thinking about what I would say today, thought about the fact that if you think about it, this health department was founded about a centennial after the last pandemic, the last big global respiratory pandemic. That was in 1918, 1919. This is etched in my mind because my grandfather died in that pandemic. And so I know that the irony that I was back to fight the next round, in public health. And so I tried to look into the history books of public health in Georgia to see if DeKalb came into being because of the pandemic, but it didn't seem to be. But who knows? I think that one thing we can say, as Ms. Pearson said, is that we did come together as a team and work together as a team in a way that I have never seen us work together in public health before. And so it gives me the great pleasure to just thank Dr. Valenciano for her work and partnership with all of us at the state, across the state, and here within all your communities. She has been absolutely a tremendous leader, a great pleasure to work with, and really committed to making everything right, regardless of how much time it takes and how much effort. And so thank you, because I don't often get, wherever you are, thank you for all your help and guidance and vice versa. So it's great to be here. And on behalf of Governor Brian Kemp, I would like to read a proclamation that he has signed. I don't know how many of you have seen these. They're really boring. They say a lot of whereas, so I'll try to skip over them real fast, but whereas, told you. The DeKalb County Health Department was founded in 1924. The DeKalb County Health Department began with 4 employees, and that was after a global pandemic, and now has more than 300 employees who provide services in the health centers and using mobile units. And whereas the department has met the ever-changing public health needs of DeKalb County, from the early days as an agricultural community to present day as a bustling, diverse Atlanta suburb. The department serves as one of the Georgia Department of Public Health's 18 health districts, and whereas the DeKalb Public Health's vision is a healthier DeKalb where all residents have equitable access to public health resources and live healthy lives, and, that one. The department's mission is to protect, promote, and improve the health and well-being of all DeKalb County residents. And whereas the DeKalb County Health is celebrating its centennial anniversary today, at this moment, I, Brian Kemp, Governor of the state of Georgia, so hereby commend DeKalb Public Health. Thank you. Woo-hoo. Yeah, I'll take it home, but I actually live in Fulton. I don't want to tell you that. And before I step down, I have to say that someone I knew as Monica Kaufman interviewed me in 1993 on a meningitis outbreak, and it's just so fun to see her as well. So anyways, I shortchanged her a little.
There was a change of plans, so CEO Thurman could not be here. But like Hallmark cards, when you care enough to send the very best, you send Zach Williams. So bringing remarks from DeKalb County now will be Zach Williams. He's the Executive Assistant and Chief Operating Officer for DeKalb County. Come on, Zach.
No pressure, huh? The very best. Yes, it's actually an honor and a privilege to just stand before you today and help to kind of acknowledge and celebrate the 100-year anniversary of DeKalb Public Health. As was mentioned before, DeKalb Public Health has and continues to meet the ever-changing public health needs of the county. Evolving from its early days, the county has evolved from an agricultural community to the present-day bustling, diverse Atlanta suburb. And when you think of over the past 100 years and think of the diversity, look around this room and see who's represented, the hardworking folks in public health and the other contributors to the overall health of the county. The transformation has brought about great opportunities for many. However, just as DeKalb County government works towards ensuring all residents have the best quality of life, DeKalb Public Health works expressly to ensure that all residents enjoy the best health possible. And they do that by ensuring the right care at the right place at the right time. And they do an outstanding job. The DeKalb County seal depicts a relay race. We can think of DeKalb Public Health's centennial anniversary as a handoff spot in that race. Our predecessors have achieved so much and have brought the county to this point. But now, we as a community must take up the baton, sustain the momentum, and strive to achieve good health for all. Again, I commend all of you for the great work that you've done, and I hope to be here at the next 100-year celebration. Who we kidding? I hope to be here in the next 5 years or so. But thank you and great job.
So did you notice a moment ago we had 3 women up here Each of them had a touch of red. And it brought to mind something that I thought about. And that is, when you think about the health of a community, you think about the health of the women in that community first. Just think about it, because it starts with maternal care. So before Dr. Valenciano comes up to the podium to deliver her keynote address, we're going to take a moment to focus on the people of DeKalb Public Health. Now, over the past century of service to DeKalb County's residents and visitors, without the tireless dedication of DeKalb Public Health's people, we would not be in this building tonight. Let's roll the video presentation where we'll hear from a few longtime staff members about their drive to serve.
For me, there has to be a purpose to life. And I go back to what I studied in Japanese context, something called ikigai. Ikigai is what gives you that passion in life, is what keeps the fire burning in your heart, is what gets you to wake up every morning and go to your place of work to serve. And it borders on the intersection of 4 variables: doing what you love, doing what you're good at, doing what the world needs, and doing, hopefully, what you're going to be compensated for. That's ikigai. And the intersection of those 4 principles constitutes the purpose and your value for life. And I think I have found that here at DeKalb Public Health. My name is Alaude Oladele, and I am a physician. I have been with the DeKalb Public Health since 1997. And I came to DeKalb for an opportunity to make a difference in people's lives. And I was looking at it from the perspective of making an impact locally, but with a global population. Hence my arrival at DeKalb County, working with refugees. And as a lot of you know, refugees arrive in DeKalb County and are people who come here with lots of issues. They have lost everything in their lives and they have been resettled here seeking better life. For us in DeKalb County, we serve about 90 to 95% of the refugees who come to the state of Georgia. And it is an opportunity for me to have an impact on the lives of people who have left everything that has, existed in their lives and have come here to start a new life.
Hi everybody, I'm Don Brunson with DeKalb Public Health. I've been here 20 plus years and I've had the opportunity to touch many lives throughout these years, starting from SUVs working in the community to mobile units. I've had the opportunity to work with young adults just starting college, to young mothers who's trying to figure out how to take care of their children, to fathers who wanted to intervene with their children, to older adults who's just trying to figure out what vaccine can I take and where. I've had the opportunity not just that, but to work with a very diverse community here in DeKalb County. I feel that just by being here, I've helped a lot of individuals become healthier, to thrive and strive, to have a better community, a strong community, so that children can do better. I've also had the opportunity to know that I've been to many different leaders here who have tremendous ideas, and I've had the opportunity to make all of those ideas come to fruition. I've enjoyed working here at DeKalb Public Health, and that's one of the main reasons why I've been here for the 20 plus years, is knowing that I'm able to get out and touch and change lives.
Hello. I came to the health department for a flu shot many years ago, and I ended up with a job. And I have worked public health for many, many years. I enjoy working with people, helping them, educating them, looking at their progress and improving their health, providing them with resources in the community, and following up to see, did they get the resources that they were referred to, and if they need additional help. My family and I are from a public health background because that's where we received our health care from. Even today, my dad continues to go to the local health department to receive his care. I believe we deliver excellent nursing care to our clients that come into the health center. And I am proud to be a public health nurse. My name is Dr. Althea Otuata. I'm a clinic nurse coordinator located at the East DeKalb Health Center.
Hi, my name is Linda Morazzo. I'm an environmental health specialist with DeKalb Public Health, and I actually started with them as an intern almost 6 years ago. And I loved it so much, I decided to apply for a full-time position, and thankfully I got it. One of my favorite parts of my job is working in the food safety program. I do inspections, but then I also have the additional responsibility of doing trainings for food service operators. I just love it because when they take in everything that I've taught them and then apply it, they're so excited to show me during the next inspection all the things that they've improved and changed, and it's just really rewarding. So one of my favorite things about working at DeKalb Public Health is every day is unique, and I get to be a part of protecting citizens from foodborne illnesses.
Hello, my name is Gordon Stacy Cargill, and I go by all three names, sometimes Gordon, sometimes Stacy. And I've worked at DeKalb Public Health since 1990. It will be 30 years in June. The thing I most enjoy about working here is the help I can give to the community. Community service, really. I help educate people in public health, what they need to do to be in compliance with the environmental laws, and what they need to do to get their permits and get their businesses started on the right foot. And that's what I enjoy most about this job.
My name is Stephanie Carter, and I am the Division Director for Community Health. And I have worked for DeKalb Public Health for 20 years. I love working here because I feel like we're a team. There have been many opportunities where we have been able to collaborate and build partnerships, and also the respect factor where people respect your talent and they also notice the work that you put in. For myself personally, I would say that I feel like I'm a true public servant. And so working in public health for DeKalb Public Health has allowed me to fulfill my intrinsic values that I look for that make me want to come to work, make me come to work where it doesn't feel like I'm necessarily working. And so for all those things and many, many more, those are the reasons why I love working here at DeKalb Public Health.
Hi, I'm William Carroll, and I'm with DeKalb Public Health's HIV and STD program. It's a prevention program that's here that provides outreach, and we provide services like testing for HIV and other STDs. One of my favorite things about working in this program is the people that I work with and being able to help others. I've been with DeKalb probably since 2014. I started working with adolescent health and youth development. And even with that program, the main thing was the people that I work with and getting the chance to do stuff to help people in the community. So being able to do stuff in the community, being able to run my mouth has been like my favorite thing about being here. I love the people that I work with.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health. We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
We are DeKalb Public Health.
And we've got you covered yesterday, today, and tomorrow.
Isn't that amazing? You can't take any of my team members, okay? Nobody can be stolen. All right, well, good afternoon, everyone. My name is Dr. Sandra Valenciano, or Dr. V for short. I am the District Health Director and CEO of DeKalb Public Health. And on behalf of the board, the leadership team, and all of our staff, I would like to thank all of you for taking time out of your busy schedules to be with us today. It's not every day that you turn 100 years old, and we have been planning the celebration for a very long time, over the past year, so you can imagine it has been a lot of work. I would like to thank all of the DeKalb Public Health staff on the planning committee who have made today possible. So staff, if you could all stand up and raise your hands so everyone can give you a round of applause. Thank you. I would also like to thank Dr. Toomey, our Commissioner and State Health Officer, for her unwavering support of public health for all Georgians, for leading us during an unprecedented time, and for supporting me in my role at DeKalb Public Health. Thank you to the board and our former board members for their guidance, support, and advocacy as we work to, this is acting up, as we work to promote and improve the lives of all DeKalb County residents. Thank you to CEO Thurmond, COO Zach Williams, and all of the members of DeKalb County government, as well as our local mayors, for supporting us, advocating for us, and collaborating with us to ensure that we're meeting the needs of our DeKalb citizens. Thank you to our Georgia senators and representatives for investing in public health and allowing us to help recruit and retain public health staff that are passionate about the health and well-being of all Georgians. Thank you. It's not letting me pause it. And last but not least, I would like to thank all of our academic and community partners, because public health doesn't exist in a vacuum. We all work together, and we rely on all of you and our partnerships to ensure that we're meeting the needs of all of our citizens. So thank you. So now I have about 20 minutes left in my presentation, and I want to make sure that I provide you with a lot of information and data, because I love data, but I know that you want to get out of here. And to keep you engaged, we are going to be doing a call and response, okay? So when I say we've got you covered, you say yesterday, today, and tomorrow, okay? We've got you covered. Yesterday, today, and tomorrow. Okay, good. That was a test, so be ready, okay? And today we're going to talk about three things. We're going to talk about the population that we serve, what the impact is that DeKalb Public Health has had on the community over the past 100 years, and what the future might look like for DeKalb Public Health. So let's start with a demographic profile of our county. In 1920, there were 44,051 residents in DeKalb, 47% female, 53% male. 45% of our residents were 20 years old and younger. 78% of our residents identified as white, 23% as black, and less than 1% as Asian. We now have over 760,000 residents in DeKalb, 53% female and 47% male. The median age is 36. 16% of our residents are foreign born. The median household income in DeKalb is $76,000. 13% of our residents live below the poverty level, and 12% are uninsured. This slide shows the breakdown of our residents by race, ethnicity, and nation of origin. As you can see, 53% of our residents identify as Black or African American, 32% as white, 6% as Asian, and 10% as other, which includes 2 or more races, American Indian, Alaska Native, and some other race. 9% of our residents identify as Hispanic or Latino, with the largest origin subgroups being Mexico, Guatemala, Puerto Rico, Honduras, and Colombia. Woohoo! Colombia, I had to. Of our residents who identify as Asian, the largest subgroups are India, China, Myanmar, Vietnam, and Korea. Among our foreign-born population, the top 5 nations of origin are Mexico, Jamaica, India, Ethiopia, and Guatemala. As we all know, there are many languages spoken in DeKalb. Among the native-born population, English is the primary language spoken at home, followed by Spanish. However, you can see that among our foreign-born population, there is a greater diversity of languages, including English, Spanish, Indo-European languages, Asian and Pacific Island languages, and others. Here you can see the breakdown of educational attainment among residents 25 years of age and older. Nearly 9% reported less than a high school graduation, 20% reported graduating from high school, 24% reported some college or associate's degree, 26% reported a bachelor's degree, and 20% a graduate or professional degree. Now that we've reviewed the demographics of DeKalb County, let's transition and talk about the impact that DeKalb Public Health has had in the community. As I go through this next section, we're going to talk about a lot of data, but again, keep in mind the call and response, so be ready. So let's start with talking about yesterday. A lot has happened over the past 100 years, and the services provided by the health department have changed over time as our population has changed, as new health threats have emerged, and also as laws have changed. I can't possibly describe everything that has occurred over the past century, so I selected some key highlights of how we serve the community over time. The DeKalb County Health Department was formed precisely 100 years ago today on April 24th, 1924. The health department consisted of 4 staff members, a health officer, school nurse, maternal nurse, and a clerk. In the 1930s, 2 staff members were added to the team, a nurse and a sanitary engineer. In the 1940s, we began to provide dental and venereal disease services. In the 1950s, DeKalb County was the first county in the state of Georgia to fluoridate its water supply, and the health department helped to spearhead that effort. During that time, we also began rabies control, polio vaccination efforts, a mobile chest x-ray unit for tuberculosis control, and cardiac nursing services. By the 1960s, the staff count had increased to 136 employees. We now operated the dog pound, enforced housing codes, milk regulations, mental health, and public health nursing services. In the 70s, the health department operated 10 community health centers. We had a health center in almost every community in DeKalb. In the 1980s, the refugee clinic was established, and we began providing HIV services. In 1994, the law changed and our community service boards were created to provide mental health services. So this was removed from public health. In the 2000s, we established the West Nile Virus Program, created the Live Healthy DeKalb Coalition, the Office of Emergency Preparedness, and received grants to address chronic disease. Throughout the 2010s, we received additional grant funding to address obesity and tobacco use. And that brings us to the 2020s, which I'll talk about next. But if there's one thing that can be said, it's that from our very beginning in the 1920s to the 2020s, we've got you covered. Yesterday, today, and tomorrow. Okay, do it again. We've got you covered. Yesterday, today, and tomorrow. Great. So let's talk about what we're doing to keep DeKalb residents healthy today. We currently provide numerous clinical services at our health centers for patients who are insured, uninsured, and underinsured. And although the health department at one point in time had 10 locations throughout the county, we now have 5 health centers, but we have over 300 employees. We provide immunizations for all services. We offer pregnancy testing and comprehensive family planning services. We have a breast and cervical cancer screening program for women with low income or no health insurance. We also have a men's health clinic that provides care to underinsured and uninsured men in DeKalb. We provide STD education, awareness, treatment, and referrals. We provide HIV testing, rapid linkage to care, partner tracing, pre-exposure prophylaxis for people at risk for HIV, and comprehensive HIV/AIDS care. We screen about 90% of the refugees that resettle in Georgia. We also have the highest number of active TB cases. We go back and forth between Fulton and DeKalb, but usually we're number 1 because the overwhelming amount of active TB cases are diagnosed among our refugee patients. We also provide oral health services and have a travel clinic at 2 health centers. Here you can see the top 5 clinical services provided since 2019 across all of our centers. As you can see, immunizations is the top service, in large part because of our COVID-19 vaccination efforts. During the COVID-19 pandemic, we were responsible for all COVID-19 case investigation and contact tracing. We operated 15 testing sites, 5 COVID-19 vaccination clinics with 2 large mass vaccination clinics. We formed a strike team in partnership with DeKalb County Fire Rescue to vaccinate our first responders, seniors living in senior living facilities and personal care homes, and homebound residents. We vaccinated educators of DeKalb County School District and City Schools of Decatur, and we partnered with an organization called CORE, Community Organized Relief Effort, thanks to the Georgia Department of Public Health, to help vaccinate our vulnerable communities. We also, in May 2021, transitioned our mass vaccination clinics to mobile COVID-19 efforts, utilizing our mobile units thanks to DeKalb County government. We focused on areas with high case counts, low vaccine uptake, and high social vulnerability. And we worked with community leaders and community organizations to ensure that there was equitable vaccine access. It's really thanks to our collaborations with the CEO, the commissioners, CORE, our community-based partners, our schools, that we tested and vaccinated thousands and thousands of people. We now offer extended hours at our health centers because not all of our patients can come see us between 8 to 5. We've reopened our North DeKalb Health Center in Chamblee 5 days per week. During the pandemic, we lost almost every single member of the clinical team that we had to limit services to 2 days per week. We also didn't have a single bilingual staff member for a predominantly Hispanic population. We now have a bilingual office supervisor, customer service representative, medical assistant, and nurse. We've resumed our travel clinic at 2 of our health centers, and we've worked incredibly hard to recruit and retain public health nurses. Out of our 28 public health nurses who provide primarily nurse-driven care at our health centers, we lost 19 nurses since 2020. Only 9 decided to stay, but I'm happy to report that we only have 2 vacancies at our regional health centers. In our community health division, our health assessment and promotion team oversees diabetes prevention, tobacco cessation, a hypertension control program, a barbershop initiative to address chronic disease, fathers offering resources and education, injury prevention, and health equity. Over the past year, we have served over 30,000 community members, held over 300 outreach events with over 9,000 event attendees, screened over 1,300 people for diabetes and high blood pressure, referred over 300 people to care, distributed over 10,000 educational materials, and our education and awareness campaigns aired over 30,000 commercials. Our local efforts towards addressing disparities in DeKalb, Lead DeKalb initiative, aims to help improve health, prevent disease, and reduce health disparities in DeKalb County. We've been funded for 2 consecutive grants from CDC, and we just received our 3rd 5-year award in September 2023, which will allow us to continue the work we've been doing, primarily focused on the African American community in South DeKalb, but now will also help address chronic disease prevention among the Hispanic or Latino population in DeKalb.
Through this initiative, we have formed numerous partnerships with community-based organizations, schools, faith-based organizations, and local government agencies to promote healthy diets, physical activity, and reduce health disparities. Our maternal and child health program includes 6 programs that provide services for women from the prenatal period to the postpartum period, and for children from birth to 21. These programs include our Women, Infants, and Children program, our Mothers Offering Resources and Education program, Children's First, Babies Can't Wait, Children's Medical Services, and Adolescent Health and Youth Development. Just to give you an idea of how many clients we see, our Mothers Offering Resources and Education program, which provides resources to pregnant mothers and their babies, served nearly 500 mothers across our centers in 2023. And our WIC program, which provides low-income women and children up to the age of 5 with access to nutrition and breastfeeding resources, enrolled over 13,000 women in 2023 and saw an increase in their caseload. Our epidemiology team completed over 14,000 investigations, 88% of those related to COVID-19, but the remaining investigations were related to over 30 unique notifiable diseases. Of those, 1,043 ended up being a confirmed case. Of those 1,694 investigations, our team investigated cases of waterborne or foodborne illness, vaccine-preventable diseases, vector-borne diseases, and other diseases like toxic shock syndrome, meningitis, influenza, and Mpox. It's truly never a dull moment in public health. The team also investigated 376 animal bites, and 109 individuals were recommended to receive post-exposure prophylaxis to prevent rabies. Our environmental health team is responsible for inspecting and permitting over 3,000 food service operations, including restaurants, schools, hospitals, food trucks, mobile movie caterers, over 800 swimming pools, 166 septic tanks, 99 tourist accommodations, and 70 body art studios. In total, across all of these categories, there are over 5,000 environmental health permits that were active in 2023 and over 4,000 inspections conducted. In 2023, we had 4 confirmed human West Nile virus cases and 1 presumptive, and these are the first human West Nile virus cases that we've had since 2020. We collected mosquitoes at 20 trapping locations throughout the county, and then of those, there were 15,000 mosquitoes that were collected. They were pooled into mosquito pools, which were sent out for testing, and 29 of those mosquito pools tested positive for West Nile virus. I had no idea that we did this when I came to the health department, okay? And I was like, mosquitoes, we have a lab, we collect them, this is crazy. Our environmental health team is also responsible for our lead prevention program. The program works with children 6 years of age and under that have been diagnosed with an elevated blood lead level of 3.5 micrograms per deciliter or greater. The average blood lead level of children referred for investigations in DeKalb is 8.1 micrograms per deciliter. Lead exposure occurs when a child comes into contact with lead by swallowing or inhaling lead or lead dust. And the most frequently identified sources of lead were spices, cooking pots, glazed pottery, and vinyl blinds. As you can see, we provide a vast number of services and resources to DeKalb residents, from clinical services to chronic disease prevention to maternal and child health to outbreak investigations to environmental health inspections, and I didn't even get to talk about our public health preparedness program or our vital records team. What's clear, DeKalb, is that we've got you covered. So what does the future hold for DeKalb Public Health? I wish I could predict the future, but I can't, and after COVID-19, anything is possible. What I can say is that over the past 3 years since I became District Health Director, we have been doing a lot of introspection and reflection as an agency and completing projects that will help us move forward and that will help us to determine the kind of future that we want to see at DeKalb Public Health. So aside from leading the COVID-19 response and providing all of the services and resources that you just heard about, we've completed an organizational restructure. We redefined our vision, mission, and core values. We developed a new strategic plan. We recently redesigned our website with better usability. We assessed our clinical operations to improve them. We've evaluated our space and our security measures. We're transitioning to paperless processes. we're really focusing on embedding a culture of quality improvement, customer service, and purpose-driven work. We've updated policies and procedures that hadn't been updated in over a decade. And we're being intentional about employee engagement, retention, and performance. I believe that all of these things help us to define the core and our foundation so that we can best serve the community externally and fulfill our vision. Our vision is a healthier DeKalb where all residents have equitable access to public health resources and live healthy lives. Our mission is to protect, promote, and improve the health and well-being of all DeKalb County residents. And we fulfill this vision and mission using our core values, which are tied: teamwork, improvement, excellence, and diversity, equity, and inclusion. We recently partnered with Accenture to develop our 5-year strategic plan over the course of 12 weeks through an extensive employee-centric process that included surveys, interviews, workshops, focus groups, and we assessed all of our operations, our partnerships, our competitors, took a look at our strengths, weaknesses, opportunities, and threats, and throughout all of this, we kept our focus on what matters most: DeKalb County residents living healthy lives, and our goal was to build a living, breathing document, not something just to sit on a shelf. The themes that emerged throughout our process are what I call our triple E principles: engagement, equity, engagement, and efficiency. My husband told me I have to read it in order because, it doesn't make sense. So equity, engagement, and efficiency. These are the overarching beliefs that guide our organization's efforts. Our strategic goals are tied to our themes of equity, engagement, and efficiency. And we established 5 agency-wide goals that apply to the entire organization, regardless of the division, office, or program. Our goals are to advance service accessibility, equity, and satisfaction, to invest in employee retention and workforce development, to expand multi-sector partnerships, to achieve financial sustainability, and to modernize our operations and infrastructure. We developed 26 objectives tied to each of these goals and to help us achieve them over the next 5 years so that we can do better and be one step closer to fulfilling our vision. But don't worry, I won't be sharing the 26 objectives today. We do have one-pagers that very nicely show our vision, mission, core values, our goals, and all of the objectives, and we're happy to share those with you. They will also be posted on our website. Finally, I've shared 3 things with you today: why DeKalb County is unique in terms of the population we serve and how that population has changed over time, the impact that DeKalb Public Health has had in the community over the past century and what we're doing now, and what the future might hold for DeKalb Public Health, at least over the next 5 years. I'd like to end by sharing a personal story that elucidates why the work that we do and the mission we're called to do is so important to me. As a physician and a leader of one of our large Metro Atlanta public health districts, I'm in a position of great privilege. However, I did not grow up with this privilege. I grew up in Miami, Florida, raised by a single mom who didn't speak English. I grew up without private health insurance and with periodic Medicaid coverage. My exposure to the healthcare system was primarily at the Florida Department of Public Health. It was thanks to the health department that I had access to preventative care and my childhood immunizations. When I walk into our North Health Center in Chamblee and I see our waiting room filled with Spanish-speaking mothers and their children, I am reminded of the times that I was that Hispanic little girl waiting with my mother to receive WIC services. When I see our patients from all over the world who don't speak English, I'm reminded of the language barriers that my mom faced as an immigrant. When I take my kids to get their flu shot at the health department, or my 5-year-old for his hearing, vision, and nutrition screening, I remember when my mom took me. When I see our patients in the community that we serve, I see me in them, and I see them in me. Over the last 100 years, our name has changed from DeKalb County Health Department to DeKalb County Board of Health to now DeKalb Public Health. And the services that we provide have changed over time. But there's one thing that has remained the same, and that's the passion that we all have for serving our community and making a difference in people's lives. So if you remember nothing else from the last 20 or so minutes, remember this: We are DeKalb Public Health, and we've got you covered. Thank you.
Telling your personal story meant everything to everyone in this room. Thank you. Wouldn't you agree? I think I need to pass that on to the AJC. That's a good story. Again, thank you for your presentation, Dr. Valenciano. Well, you know, music is a form of public health for mental health. Music can soothe the soul. So please welcome the DeKalb School of the Arts Jazz Ensemble again for another musical selection under Mr. Moore. You know, Mr. Moore, you might want to take them on the road. They are excellent. Thank you again for your performance. Well, I am here, I guess, in two steads, but to talk about DeKalb Public Health. Public health service should be as fully organized and universally incorporated into our governmental system as it is public education. The returns are 1,000-fold in economic benefits and infinitely more in reduction, 1,000-fold of suffering and promotion of human happiness. Now, who said this? Herbert Hoover. Yeah, how contemporary is his saying? Public health service should be as fully organized and as universally incorporated into our governmental system as is public education. The returns are 1,000-fold in economic benefits and infinitely more in reduction of suffering and promotion of human happiness. He said that back in 1931. Actually, it was longer than that, over 95 years ago. And his statement is still very relevant. DeKalb's public health was already 5 years old when he was president, elected, providing services for schools and maternal health. And while Hoover was president, DeKalb Public Health added sanitation and engineering services. How ahead of its time DeKalb was. Over the decade, the agency has been on the forefront. As you heard Dr. Valenciano say, the first Georgia county with fluoridated water. And in 2015, opening Georgia's first drive-through WIC clinic. Just think about it. As a child growing up in Louisville, Kentucky, I can remember the fear of polio. I can remember even having a classmate in the 8th grade who was on crutches because he had spent time in an iron lung with polio. And then when it appeared here, the polio vaccine was administered here, just as COVID-19 vaccines were administered in our very recent history. The difference about it was that polio, you learned about it either on radio or you learned about it in the newspaper. Today, you learn about those things that are bringing us fear and poor health on television. It's brought into your living room to educate, inform you, and put you to work in taking care of yourself. But you know, the Department of Public Health is also in the prevention business. As early as the 1940s, DeKalb's was providing rabies control services. Then there's the mobile stroke and heart attack prevention programs. And then, as you talked about, Dr. Feliciano, the West Nile virus program. But I like the Live Healthy DeKalb Coalition, working together to keep us all healthy. And because of its excellence in addressing the needs of our community, DeKalb Public Health received significant grants, and many people don't know about them. CDC Strategic Alliance for Health Grant to address chronic disease, the racial and ethnic approaches to community health grant, and the communities putting prevention to work, the grant that addresses obesity and tobacco use, which leads to many deaths, particularly in minority communities. But the heart of this agency is its clinics, its health centers. I'm not gonna name all of them, but you can go to Brookhaven, you can go to Chamblee, you can go out to Doraville, Lithonia, Stone Mountain, and Tucker. Public health is people health. And DeKalb County, in its 100 years, has touched so many, from opening a clinic in the 70s in the now gone East Lake Meadows Public Housing Community, to opening its doors at the Disaster Relief Center to evacuees from Hurricane Katrina in 2005. Refugees from many countries have settled in DeKalb County, many in the city of Clarkston. Now, the department estimates it has served almost 50,000 refugees over the years. And I have a beautiful handbag called Pieces of Thread from the refugee community in Clarkston. But not only are women there learning how to make peace, P-E-A-C-E, with threads, they're also having their maternal health needs addressed. So why is this information worth recounting to you today? From the media standpoint, if you know it, you can do more about it. We often take for granted the things that we have, but today, we need to think about where would we be if it had not been for the DeKalb Public Health during outbreaks of disease. Someone once said, "Your health is your wealth." Citizens of DeKalb are reaping the benefits from the investment in public health. DeKalb Public Health has grown continuously to meet the needs of the people who live here. As times changed, it changed to address the health issues the people of this county faced. Now, I'm sure that will continue in the next 100 years as you look around the community and identify the needs and how to address them. For instance, the unhoused, the unsheltered. Leanna Wynn is a physician and is a former commissioner of health for the city of Baltimore, Maryland. She wrote, "Public health depends on winning over hearts and minds. It's not enough just to have a good policy. You have to convince people to follow it." Whatever the future brings, I'm convinced DeKalb Public Health will continue to win hearts and minds and convince people to follow the policies it has in place for the betterment of all the citizens of DeKalb County. 100 years down, another 100 years more to go. And as we end our program, Beverly Burks will come to the microphone as the board vice chair of DeKalb Public Health. Beverly.
I think that's my pre-COVID photo too. Well, good afternoon. I'm Beverly Burks, Vice Chair of the Board for DeKalb Public Health. And I also serve as the Mayor for the City of Clarkston. And these two positions create a unique union. As a refugee resettlement community, not only do I have a connection to serving Clarkston residents, but many of those residents receive their initial screening and health services soon after arriving in the United States at DeKalb Public Health. So I am humbled and honored to serve my constituents in both roles. Now, can you believe we've reached the end of the program already? I know some people have been spying those cupcakes back there, and I know it's between me and you and those cupcakes. But a centennial only happens once. Then time marches forward. As we conclude, let us reflect on just how essential the work of public health is now and in the future. No truer works could have been spoken by the late Dr. C. Everett Koop, the 13th Surgeon General of the United States. Healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. To all of our invited guests, dignitaries, and elected officials, on behalf of DeKalb County Board of Health and the staff of DeKalb Public Health, we cannot express our sincere gratitude for your presence today as we celebrate our centennial observance. Thank you to Dr. Valenciano, or as we affectionately say, Dr. V, and the DeKalb Public Health Senior Management Team for your leadership yesterday, today, and as we move forward into tomorrows to come. A very special thank you to the DeKalb School of Arts for gracing us with their talents today. Let's give them another round of applause. And you keep those hands warmed up, because next, please join me in giving a very warm round of applause to an Atlanta broadcast legend who is still making her mark in this community. Our MC for this occasion, Mrs. Monica Kaufman-Pearson. And my sorority sister, too. So, yes, thank you for being a part of this historic occasion and sharing your reflections with us today. Finally, we would be remiss if we did not extend our thanks to the staff volunteers who spent months planning this special occasion and mere hours setting it all up. Give them a round of applause. To mark the beginning of this next century of service as DeKalb Public Health, please join us at the back of the room as we have a ceremonial ribbon cutting. And after that, we welcome you to continue to network and socialize as the DeKalb School of the Arts Jazz Ensemble performs. Thank you again.